A stroke is a life-threatening medical condition in which poor blood flow to the brain or bleeding of the brain causes death to brain cells. If a stroke is not timely diagnosed and treated, it can result in severe disability or death. Today, I would like to discuss with you 3 common scenarios that we come across in our practice involving the negligent failure to diagnose or treat strokes. 1. Following a traumatic brain injury. 2. Medication mismanagement for atrial fibrillation. And 3. Recovering from an angioplasty. Following a traumatic brain injury, you are often at an increased risk of either a hemorrhagic or embolic stroke. Hemorrhagic strokes are caused by bleeding, usually from a rupture of a blood vessel in the brain. Embolic strokes are caused by a blood clot that prevents blood from traveling to the brain. The risk of stroke following a TBI is even greater for adults over the age of 65 years old. For example, a person involved in a motor vehicle crash might be treated in the ER and begin to exhibit signs or symptoms of a stroke, such as inability to move one side of their body, slurred speech, a facial droop, problems understanding someone, or problems speaking, dizziness, sudden loss of vision, a severe headache. It is important for medical professionals to recognize these symptoms as possibly relating to a stroke, and to order the necessary testing to rule out or confirm a stroke. If instead, the doctors choose not to order the appropriate test and discharge the patient home, and then that patient goes on to suffer a severe or fatal stroke, there is likely a strong case to be made for medical negligence. A second common scenario we see relates to failure to properly manage preventative medications. People that have a common heart condition called atrial fibrillation are at an increased risk of a stroke because irregular beating of the heart can cause blood clots to form that can travel to the brain. There are medications called anticoagulants like Coumadin or Eliquis that help to thin the blood to prevent clots from developing. Our firm has handled cases involving miscommunication and mismanagement of anticoagulation medication, resulting in a patient suffering a stroke due to not receiving this necessary medication. The third common scenario involving strokes that we see involves patients recovering from an angioplasty. You may have also heard of this procedure called a cardiac catheterization. The procedure is used by clinicians to determine if there is enough blood flow to your heart's blood vessels. It may be done if you have experienced symptoms like chest pain, heartburn, or shortness of breath. This is a relatively straightforward procedure done laparoscopically by threading a catheter through an artery in your groin up to your heart. Nevertheless, because a catheter is being threaded through a main artery, there is always a risk of plaque breaking off, traveling to the brain, and causing a stroke. This is why it is important for nurses and cardiologists to monitor patients recovering from an angioplasty for signs of this type of stroke, including a severe headache, dizziness, vision loss, and other symptoms that we discussed already. Without timely diagnosis and treatment, a patient may suffer from severe and permanent disability like vision loss, paralysis, or even death. If you are concerned that a stroke should have been prevented with proper medical care, it is important to speak with an experienced brain injury lawyer that has handled stroke cases. We are happy to help. To discuss a potential case, give us a call at 312-527-4500 or visit us online at passenpowell.com.